Hello, my name is Matthew Hilton. I'm the CEO of the Advocacy People, and welcome to our short video, which is going to explain how advocacy can support people who are under section in a mental health hospital or unit or in the community. We hope that by the end of this video, you will know who the Advocacy People are, you'll be able to describe what advocacy is, and you'll understand the role of the Independent Mental Health Advocate under the Mental Health Act of 1983. So before we get into the main presentation, I just want to say a little bit about us and about advocacy. So we are the Advocacy People. We were previously called CAP, and we are an independent charity. We work across the south of England. We provide free and independent advocacy and related services. You can see precisely which services we deliver in your area by the map on the front page of our website. Advocacy can be quite hard to understand. It's often confused with the same legal term. But put simply, our advocates provide an independent voice for the person they're working with, the client, obtaining and passing on their views when decisions are being made about them. We make sure that their rights are being upheld and that proper processes are being followed, particularly when the person lacks capacity or the confidence to speak up for themselves. We all know, I think, how hard it can be when we don't feel listened to, when what's important to us isn't being taken seriously by others, or when we don't have the words to say what we really feel or want. And that can be even more difficult when decisions are being made about our health and social welfare. And of course, many of the people you're likely to be working with perhaps don't have the capacity to engage fully in the decision-making process. So by engaging with the person as far as possible and speaking to the people around them as appropriate, we build up a picture of the client's needs, wishes and views and communicate those on to decision makers. And what sets us apart from other people involved in health and social care really is our independence. We don't make decisions. We aren't emotionally involved. We don't deliver care or treatment. And all this means that we can remain objective and person-centered. We have no vested interest other than to ensure that the person's voice is heard and that their rights are upheld within the relevant frameworks. So I'd now like to present our two presenters today. First, Colin Bibby, an independent mental health advocate, or an IMHA, who's based in Berkshire.
Hello.
And also Karen Haycon, who's an independent advocate from our East Sussex team.
Hello.
Hello to both. And both are here to share their expertise with you so that you can understand how advocacy can help. So now over to Colin, who's going to explain a bit more about why we're doing this webinar and what we hope to achieve.
Thank you, Matthew. Our work as advocates has changed so much over the last year. Normally, we would be visiting the wards, spending most of our working time there speaking directly to patients and professionals. By having this presence, it was easy to tell people about what we do and how to get our support. Whilst the webinar can't replace such face-to-face contact, we hope that this will go some way to reminding people of the role of the IMHA. Referrals have continued during COVID-19, but pre-pandemic research suggests that only about half of those who are entitled to support from an IMHA actually get it.
Thank you, Colin. As Colin said, we aren't currently working fully in the way we would like, but that certainly doesn't mean that the need for advocacy has in any way diminished, and we're doing all we can to continue to advocate for people pending our full physical returns to the wards.
Imagine you've never been in hospital before, or certainly not in one where the doors are locked and you aren't allowed to leave. You're sitting in a room full of professionals, all talking about you, discussing what they think should happen to you. Physically, you are there, but you don't feel there in your head. Things are being said which you might or might not understand. You struggle to speak up, or you feel you're not being listened to when you do. You can't make the decision you'd normally make about your life. Other people are making them for you. Where you can go, the treatment you're being given, when you might be able to leave. So, what are your rights and how do you find out what they are? The first right the patient has is a right to advocacy through an IMHA. That means an Independent Mental Health Advocate. This is set out in the Mental Health Act and looks like it will be strengthened with the Mental Health Act review that is currently being done. The legal right to an IMHA applies if they are sectioned under certain but not all parts of the Mental Health Act. Most commonly, this will be when detained under Section 2 for the assessment, then Section 3, which is for treatment, or Section 37, when a court decides what instead of going to prison, the person should be in hospital for treatment of a serious mental health condition. Those who are liable to be detained, for example, when on leave of absence from hospital, and those under community treatment orders and guardianship, are other circumstances in which IMHA support is a legal entitlement. Whilst our focus here today is on those under section in hospital, the same principles of supporting people to speak up and have their rights upheld equally applies to those other eligible groups of people.
So, do the people you work with have other disabilities or health conditions in addition to mental ill health?
Yes, we often work with patients who, for example, have a learning disability, dementia, or on the autistic spectrum.
And what sorts of issues can an IMHA help with?
Basically, anything to do with their section, including understanding any certain decisions have been made, their rights and the rights of others, such as the nearest relative, treatment and treatment options, conditions and restrictions, Section 17 leave. Also appealing the section.
Thank you, Colin. So, Karen, turning to you now, perhaps you could talk a little bit about how a patient would know about their right to an advocate.
Information about the IMHA service should be actively given to patients at different stages. This could be by the approved mental health practitioner who first places the person on section, the Mental Health Act office who will write to the patient to explain their rights, when staff are reading someone's rights to them at any time or at any time during a patient's detention in hospital. We provide leaflets explaining who we are and what we do that can be handed out and also left in areas such as visitor waiting rooms. We also provide posters for display on the wards, usually with the photo of the IMHA who usually picks up referrals from that ward.
And can the patient refer themselves, or does a member of staff need to do that?
If they feel able to, the person can refer themselves, usually by phone or when possible in person on the ward. If they don't feel able to do it themselves, a member of staff or the person's nearest relative can make the referral by phone or email. If the patient lacks the capacity to decide whether to instruct an independent health advocate, hospital manager must make a referral. Information and referral forms can be found on our website.
And what can someone expect then once a referral has been made to the advocacy people?
The advocate will arrange to meet the person, ideally face to face. But if not, they will work with the ward to arrange a time for a phone or video call. Wherever possible, this should be somewhere the advocate and patient can talk in private. Before going into detail of the patient's concerns, the IMHA will explain the advocacy principles, checking for understanding at each step, covering the role of the IMHA, including limits of what they will and won't be able to do, our independence from decision makers, privacy and confidentiality. We will then go on to find out that the patient's situation and their concerns, help them understand their detention, explore options and agree what action will be taken and by whom. It's important to note here that the advocate will always act on the instructions of the patient within the bounds of legal activity and will not form a judgment or tell the person what to do. Where the person doesn't have capacity to instruct, the advocate will work to understand what the person would want to happen and ensure their rights under the Mental Health Act are upheld. This is called non-instructed advocacy.
Okay, thank you. Could you give some examples, perhaps, of what actions the advocate can take to support the patient?
Certainly. We are often a bridge between the patient and medical professionals to ask the questions, seek information, raise concerns. With the patient's permission, we can access medical or other records about their detention. We can support the patient at meetings, representing them and speaking on their behalf. For example, ward rounds, multidisciplinary meetings, and managers' hearings. We can help the patient to make an application to the Mental Health Tribunal, access legal advice, and then support at the tribunal.
And as a final point, how can advocacy support medical professionals in their work?
This can be best illustrated with an example. The client Jay was a highly thoughtful, sensitive and articulate individual who was extremely distressed at his admission and treatment and felt that the Mental Health Act and the actions taken by staff under its authority represented a violation of his basic human rights. By working in the way I explained earlier, the advocate was able to review hospital records and meet with relevant staff to establish a clear picture of Jay's admission. The information was discussed with Jay in a way that was appropriate to meet his needs. This enabled Jay to understand the purpose and rationale for his detention and remove the angst he had felt towards the staff.
Right. Well, thank you, Colin and Karen, for presenting today. And thanks to everyone who's joined us. Thanks to all of you. I hope that the information provided has helped you to understand how advocacy can support patients under section, either in hospital or the community, and how you can help them to access this support. Please do take a look at our website, follow us on social media, and if you have any questions at all or would like to make a referral, please do get in touch. Thanks very much.